Hi, welcome back to our show. We're here with Bill Abajian. He's with Generex, and he's brought two dynamic products over to show us. So, tell us about the one people can buy now.
Right now, we're selling a product called Glucose Rapid Spray. For the first sign of low blood sugar, it's sprayed 10 times, and the person comes out of the low blood sugar event very slowly and easy. It's a buccal mucosa delivery system, so it's instead of being digested, it's ingested into the mouth, so very quickly going into the bloodstream. It's sold throughout the country right now in all retail stores and internationally throughout the Middle East, Europe, and South Africa.
Tell us about the paper that you've just got published.
A paper was just published in the American Diabetic Conference showing a 5-gram glucose tablet and 10 sprays of Glucose Rapid Spray.
Which is less than 2 grams of sugar.
Which is less than 2 grams. Because of our delivery system, we saw that the 5-gram tablet took 15 minutes to peak up 10% blood sugar raise, versus 10 sprays of our product took 2 minutes to go up 10%. It showed the benefit to the first signs of low blood sugar, and that paper was endorsed by the American Diabetic Association.
So he's saying this is less sugar and it works faster when you're low.
And we call it sweet and simple.
Sweet and simple. Do you probably need to, it's possible it might start falling again because it's so little, you need to keep shooting or eating?
It's the first response to low blood sugar. It's a common sense approach because in the past, people took multiple tablets, their blood sugar got too high, and they threw themselves back into the deleterious position of being diabetic again. So in this case, less is better.
Okay. I'm going to try this because I do get low occasionally. So tell us about your other product, Bill.
This is our oral insulin product. The product is called Oralin. Generex just started our phase 3 trials independently in the U.S.
So it's not available yet?
No, it's not available yet, but we started our phase 3 trials. We're picking our centers of excellence. We're also recruiting our patients. Our protocol has been approved through the governing bodies in Europe, Canada, and the U.S. And we're on our way to trying to get the approvals to get the product in the market in the U.S. and Canada and worldwide.
So show us how it works.
We have human insulin put into a canister under pressure, which needs no refrigeration. We have a unitized dose, which is 1 unit of insulin sprayed throughout each puff. We shake the canister 5 times. It goes in through the buccal mucosa, a vascular area of the mouth. As soon as it's sprayed, it is not a pulmonary insulin. It's a buccal mucosa delivery insulin. The particles are 7 micron in size. Because of that, they do not go into the lung. It's sprayed in through the mouth, goes all the plumage in through the mouth, and it turns out that through 5 sprays at the beginning of the meal and after the meal, it is a mealtime postglandular insulin.
So how quickly does it start taking effect?
Within 15 minutes it peaks off. At the end it tails off, so you have a very low chance of hypoglycemia.
So it's actually much faster than the fastest insulins that you can inject.
It's a quick insulin. It's a mealtime insulin. It's being sold right now actively in Ecuador, and it will be sold probably within the next 3 months somewhere in the Middle East.
So as opposed to that other one, the Exubera, where you have to breathe it all the way down into your lungs, this you're just trying to get into the cheeks.
We believe that, again, less and non-invasive is better. Putting it through the buccal mucosa, not having something go into your lungs, having the patient population be a lot larger with a product like this. Smokers can use it, children can use it, older people can use it. Because of that, we believe that it brings a quality of life and compliance to the patient, which means they'll use the product, meaning that we'll all be successful in compliance and financially.
So Bill, the big question is when can I get it? How much will it cost?
At this point, it's not available in the U.S. and Canada. It is available in Ecuador. It's sold for $30 per unit in Ecuador.
And how many units of insulin is that?
It's 400 units of insulin with 10% bioavailability. So there's 40 units per canister. So a canister's lasting about 2 days.
Okay. So it's quite a bit more than shots of insulin.
It's about 20 to 30% more, but it's a mealtime insulin.
So one canister is $30.
Right.
It lasts 2 days.
Right.
That's more than 20% more. I mean, I'm not saying it's too expensive. It's just to give our viewers a comparison.
The comparison that we're looking at right now in South America, we're seeing it as an expensive alternative to injections.
Okay.
But we're also seeing in South America and other marketplaces sharing of needles between families, which is unacceptable.
Yeah.
We're seeing non-compliance of drug because they just can't get it. So we're working together with health ministers in Kuwait, Qatar, Dubai, Saudi, the Brazilian government to make sure that this product can be affordable to all people. We're looking for registration in India probably within the next 30 days.
Congratulations.
My pleasure.
And here it's maybe a few years off.
It's a few years off. The FDA is very thorough. And we just hope that they're open to a small company that wants to go it alone, that wants to make good quality health care for the U.S. marketplace.
That's great.
Done.
Thanks for coming on the show and sharing that with us.
Thank you.